Hey, I'm Dr. Brian Scott, a pharmacist and owner of Scott's Pharmacy. Thank you so much for participating in our Healthy Lecture Series. This lecture series is about erectile dysfunction. And at the end of the series, we will have discussed the causes of erectile dysfunction, therapies to help when other treatments have failed, as well as natural things you can do to get to the root causes of erectile dysfunction. In previous lessons, we have discussed diseases that can cause erectile dysfunction, prescription medication, and bad habits that can cause erectile dysfunction. Remember, as men age, their hormone levels begin a slow decline. Testosterone and DHEA levels begin to drop, while estrogen levels tend to increase. This is a condition known as andropause, and it's slightly different than menopause. When women go through menopause, their hormones pretty much fall off a cliff. And you see the side effects pretty dramatically and pretty quickly. Andropause, on the other hand, typically occurs at a much slower rate until one day a man wakes up, he's more tired, less muscular, less motivated, and may start having issues with erectile dysfunction. In the last lesson, we talked about testosterone and erectile dysfunction. In this lesson, I would like to talk about the hormone DHEA and erectile dysfunction. DHEA is a prohormone, which means it turns into all of our other hormones. As we, both men and women, age, we produce less DHEA. Low levels of DHEA are linked to a decreased sense of well-being. People just feel better when their DHEA levels are in the optimal range. Much like testosterone, the relationship between erectile dysfunction and DHEA is a complex one. We do know that men with lower levels of DHEA experience erectile issues way more than men with normal DHEA levels. DHEA's role in erections and libido is not just from DHEA itself, but also from the fact that DHEA is required to produce testosterone and estrogen. DHEA does have the ability to stimulate blood flow within the vessels, and remember, erectile dysfunction is all about blood flow. In addition to age, stress can also result in lower DHEA levels. While DHEA most likely will not be the magical supplement to reverse erectile dysfunction, if your DHEA levels are low, you should consider supplementation. There is a good chance your erectile dysfunction will get better and you will have a better sense of well-being. As with all of our lectures, I hope you learned something you didn't know. Feel free to take our next lessons on how stress and other bad habits can affect your testosterone levels and ultimately your sexual health. Dr. Brian Scott, Scott's Pharmacy.